welcome everyone. It's Friday, and we're here with another Friday webinar that we do on a consistent weekly basis. So we appreciate you joining us as we head into the weekend. We hope everyone's had a good week, and we're excited to be here. Just a couple quick house cleaning notes. We will keep this in listen only mode. So if you do have some questions, please type those into the chat box, and we will be checking that and try to answer those as quickly as we can. If we have some extra time at the end, we may be able to unmute some of you and ask live questions to Clayton and his team to certainly make sure that you guys are fully understanding what it is that we're presenting here and how it can benefit your sales going into this AEP and beyond. So again, thank you for joining us today. I know some of you with us today, we've probably seen this week, we were on the road doing our Medicare Sales Summit. So we thank you for coming out, joining us. And again, we mentioned this at each of our events. So we're excited that some of you could join us today. All right, well, let's go ahead and get started. I will introduce you to the team and then let them take it from here. So again, we want to welcome everyone to our Friday webinar series. We're extremely excited. This has been a process, a platform that we've been working on with Trusty Care for many, many months now. And here it is, Clayton. I know you guys have been hard at work for many more months. And we now get to show the agent population what it is that you guys have been creating in those back rooms and feverishly typing away to create. So we're excited. Insurance Advisors Direct, we're an FMO partner with Trusty Care. They are the machine behind this platform. Clayton and his team have been working to build this out. And again, we are excited to be a partner of theirs and excited to roll this new tool out to all of you as our independent agents. This tool will do much more than just enroll, but we know that's an important component. Clayton is going to kind of step you through each of those fantastic parts of this program so you can see firsthand what it can do, how it can work, and how it can benefit your sales and speed up your sales process when it comes to Medicare. And then we plan on expanding it with Trusty well beyond that. And this Easy Enroll, you will be able to find that if you're a contracted agent with Insurance Advisors Direct and you log into our website and you're part of our agent portal, you'll find that Trusty Care Easy Enroll button where you can go in and get started. And we'll talk a little bit more at the end about how to get involved in this platform if you're not already signed up. So again, we hope all of you get involved and see the value here for both all components, everything from the CRM component, the lead tool, quoting comparison, and certainly the enrollment portion of that. So again, we're excited to roll this out for the first time to a much larger audience. We did a smaller, softer rollout a few months ago to do some testing, but here we are, leading into this AEP. And again, excited to put this tool in each of your hands. So with us, we have Clayton and his team, Tiana. Clayton's going to be taking you through the program and helping answer any questions that you have. So again, welcome, Clayton. Thank you for joining us, and I'll turn it over to you.
Great. Thank you, Jason. I'm excited to talk to everybody about this Trusty Select Pro with Easy Enroll with Insurance Advisors Direct. There's going to be, it's kind of a 40,000 foot level I want to go over today, just to kind of explain how the system works and how we can relieve your administrative burden this coming year. When Jason will set you up with this is where he'll be distributing this to you, and this is your instruction of how you can complete your initial setup. So that's what this slide is in here for. The pieces I'm going to be talking over today is our data. How do we get our data? What is different about how we capture that? I'm sure a lot of you use Medicare.gov. And so I want to explain that data component because the way we get our pricing is a little bit different, the way that we have designed that. Then I'm going to talk about the functionality of Trusty Select Pro And that's where I'm really going to be digging into how is this going to alleviate your administrative burden this coming AEP and beyond. And then I put together a sheet it's a timeline of, are you ready for AEP? What can you do right now to help reduce your stress going into October 1st? So let's talk about our data. I should have got a drink of water. I'm sorry, Jason. Let's talk about our data real quick. So how we get our drug pricing is two ways, or not two ways, but it combines into one here. So we have over here the insurance carrier. Every month, they're going to report to CMS monthly what they're committing to pay for a specific drug in a specific region. And that region, as you know, is classified as a county. That's why it's so important that we have that county in there. Then as they put that into CMS, CMS will take and give us the actual drug costs reported to CMS via the blue button. So this is a really important component. We're the only ones that do this, is we take that blue button information. So to explain that a little bit further, when you go to the pharmacy, you fill your drug, you fill your prescription, they will then take your MBI ID and then file that up to CMS. Then that's where they capture what pharmacy you're at, what drug it was, the dosage, and then how much you as the beneficiary actually paid for that drug at the register. That's the price component that sets us apart. We're the only one that combines what the client is paying, as well as combining that with the carrier's commitment to pay. So we marry those two together, and that gets us closer to the actual cost of the medication. So we bring that into Trusty Select Pro, and I'll show you how that works within the system here in this demo today. So what we'll talk about today is, how do you enter beneficiaries within Trusty Select Pro? We have the ability to do a bulk upload up to 5,000 beneficiaries at one time. You can bring directly into Trusty Select Pro. We will have, we'll talk about the manual entry, and then also Lead Builder. What Lead Builder is a iframe that you can put, it's a little widget that you put on your website. You can direct your traffic to your clients to that. It will allow them to put in their first name, last name, email, phone number. And then once they hit submit, it writes directly into Trusty Select Pro right from your website. So that's a really powerful tool as well. The next thing we're going to talk about is updating medications. So we have the blue button. We can bulk email all of your clients at one time, asking them, hey, it's time to import your information. You can also do that blue button import on their behalf. Once you get all of that information, I don't know why my video just did that, I apologize. Once you get all that information, that's where we're going to do a batch process. So this is the really neat thing that we can do, and this is going to be a big piece of alleviating your administrative burden, is taking all of that hard work of you putting in the medications, putting in the current plans, and then once the new plans drop, we can process every one of your clients and run a drug comparison. Do they need to stay in their plan? Do they need to change their plan? Do they need a new plan? And we do that within minutes for all of your clients. Then we're going to talk about sending the scope of appointment electronically through Trusty Select Pro. And then I'm going to touch on the direct enrollment capabilities within the system as well. Now, here's the timeline that I was talking about. This is something that Jason and the team will send out to you as well. But what I've done is I've laid out kind of where you would be at about this time, right? So August, we're going to be updating your medications. You're going to be doing the blue button imports, and then the final preparations in September. October, once the plans drop, and I know me and Jason and everybody were like, please CMS drop it on October 1st this year. Don't delay. So once we do that, that's when we're going to do the batch processing. So without further ado, let's go in and let's take a look at the system within Trusty Select Pro. So this is the first screen after you log in. This is going to be your beneficiary view. This shows you all of your clients in one view. You can search for your clients. You have the ability here to specify, is it in progress, closed one, so that you can track those later as well and kind of see how your progress is going for that AEP. Now, once you enter a client, you do that by adding a single beneficiary. And this is the form you would fill out to get that profile set up for your client. I've already done that for the sake of this training, so we're not going to go through and you'll have to watch me boringly go through that. So once they're set up, I go into their profile here, and I can see all of their information here. I can see their plan info, their MBI. I would be able to put that right here as well. Their tobacco consumption, if you're doing a med sup. The income range, this is an important piece too. A lot of agents like this because right now when you do the IRMA adjustment, it's manual. You go through and you look, you pull out your calculator, and then you're going to add that to it, right? To what their premiums are. We do that all for you. So all you have to do here is specify what is their income range, and then we're going to calculate that adjustment for you. And a lot of people really like that. A lot of people are like, yeah, mainly the people that live in Huntington Beach. This is my monitor doing this. Sorry about that. Mainly the people in Huntington Beach, California, where everybody makes a boatload of money, they're going to say, yeah, no, I prefer not to say. So anyway, I joke about that. The hospital effective Part A and Part B dates, this comes in automatically from the Blue Button import from CMS. So you don't have to necessarily worry about populating that information. Their current plan comes over from the Blue Button as well. The pharmacies, so you can put in as many pharmacies as you want. I know that's a big thing. I know there's a lot of systems out there that only allow 1 or 2. You can put in as many as you want. So using the zip code for IAD, I can put in, let's see, my Bluetooth keyboard has to kick in. It has to wake up if I don't use it right away. So this is going to give you the full list. So I type in CVS, it's going to give you CVS first. And then it's going to branch out from there, and then you can select whichever pharmacies you want, and then instantly it's going to add those pharmacies right up top, as many as you want. Okay, you can delete those like I just did. Now the doctor lookup is really neat. We pull in any doctor in the country, and we base it on the zip code of where they're registered. So we have a link, a knowledge article that has a link to the NPI registry because that's where that zip code is. It's not where their office is, it's where did they register for and where are they registered on the NPI registry. So the neat thing here is I can actually come here and type in family, and it will pull up all of the family practices here. I can type in the like oncologist, if I can spell that right. So there's the oncologist. Okay, so this is a pretty neat thing that I actually just discovered this last week, Jason. So I'm kind of excited about that. So we'll do like Ander. So that will look at any letter combination for Anderson, and that's kind of how that particular functionality works. Again, I've selected a couple there. I'll add a few more, and there's no limit to the doctors as well that you add. Medications, this is the same way. So you can enter all of this. Now keep in mind, all of this stuff that I'm entering will pull in from Blue Button, mymedicare.gov. So I'm doing this manually just to show you, but when we do the Blue Button import, it's all going to come over. And we only look back 1 year. So we don't do a look back of 10 years, however long they've been on Medicare, which is a really important piece because they go off medications quite a bit, right? So, but medications, you would just key in the medication. We have the full list. The key thing that I want to point out here that a lot of people like is, see how I typed in atorvastatin? We're going to show all the drugs that have atorvastatin in it. So that's the same, you know, any drug that you have like morphine, we're going to show all the drugs that have morphine in it as well. Now I've already gone through and entered in the medication here. So now I'm actually ready to go in and run a quote. Before I do that, I want to talk about the notes, activity, and documents. So in their profile, you can put any note in here. So Austin Powers really wants to know who number 2 works for. So I'm going to put a note in there of who they work for, right? So now if they have a doctor question, medications, I can put a note in as well. And those notes stay as long as you want. The documents, this is a repository that meets the CMS guidelines of 10 years plus the current year. And that document repository, you can put any kind of document in there. You can do PDFs, you can do Excel, you can do JPEGs. It doesn't matter. You can load anything you want up in there. Now you can delete that as well if you want to by clicking the trash can. Now let's go in and let's take a look at running a quote. And this is a really, I've used this term more than I have in the past, but powerful. This is a really great feature that we've added. Jason mentioned that we've been working really hard, and this is one of the things we've been working hard with. So this allows you to see all of the carriers that you have been enabled to quote for. I can see for the PDPs, I can see all my pharmacies, and I know this is the pharmacies that I put in. I can see based on these 29 results, I can see is Meadowbrook Pharmacy in network, only in network for 26. But that's in network meaning standard or preferred. Now, if I want to take and narrow that down to preferred, there's only 6 plans where that pharmacy is preferred. And that's a really neat thing, because now you don't have to dredge through and scroll and try to dig in and find. You can see right away which ones they have to pick from, and then you can kind of go from there. Now, if you want to view the details of that particular plan, you can view the details here, and this will break out all of the drug costs, the premium. There's your IRMA adjustment if you had one. The tier cost overview is, as you know, based on that particular plan that they go over, or the plan that you're picking right here. And we will always show of those drugs the retail cost of the medication in the before deductible phase if they are needing to meet that deductible. Okay, so this one you can see tier 1. This one they don't need to meet the deductible. So what we show is the tier cost. This is a tier 1. It's refilled every 3 months, so it's $3. We show that in both places. Now the retail cost here for 3, 4, and 5, they always need to meet the deductible. So we're going to show that here, and then you have your breakdowns as it goes through each one of the phases. The month over month shows you at what point do they hit that particular phase. So we crossed over and we got into the initial phase in October, and then we didn't get out of that initial phase because we just don't have enough time in the year to do that, right? So we have to hit that 4130, and then that will push you into the gap. And then once you hit the 6550, there's your catastrophic, and we will show all that. Now the referring or the preferred pricing, you have standard pricing as well that you can view. You can print out this information for your clients as well and send that to them. And this will show preferred and standard pricing as well. Now, looking at comparing, so if I click 2 of these plans together, I can do compare plans, and now it will pull those 2 plans together, and I can view the pharmacies and costs. If they're out of network, it's not going to show anything, right? Estimated monthly, there's your month over month for standard, and preferred, and then your monthly cost breakdown of the drugs, for standard and preferred as well. You can print this and send this to the client as well. And then you can send this to your client. Jason, I see some questions coming through. Do you want me to just continue through and then we'll come back to the questions, or how do you want that to?
I've been actually answering those questions.
Yeah,
I think
okay.
the only one that I would like to make mention of, because you kind of touched on it and it was one of the questions asked, is when an agent is given access to this platform through IAD, what carriers will they have access to? And we have made a business decision that we will make sure that all carriers, so if you are effectively an agent of ours contracted with some of our carriers, we are going to turn on all carriers. So regardless of if you're appointed with us for that carrier or not, you will still see them in this system and potentially able to enroll if that carrier is obviously something that you're moving forward on. So we are not going to limit it to just the carriers that you have contracted through IAD with.
Okay, let's talk about the Medicare Advantage plans, because I know that you guys do those, you do SNPs as well. The filtering is pretty much the same, but notice we have more toggled on. So you can narrow this down by plan type. So again, if I only want to see PPOs, it's going to show me 18 in my area, okay, of plans that are PPOs. If I wanted to see HMOC SNPs, it would show that. Now, if I wanted to just see all C-SNPs, there's your D-SNP plans right here. So you have Zing, Align, Ericsson. If you wanted to see the D-SNPs, you have 8 D-SNPs there. And so it takes and it filters out everything, all of the noise, and lets you just focus right in to what you're trying to quote for your particular client. The neat thing here too is all those doctors that we put in, we can see of those 48 plans, which doctors are in network for those plans. So I'm going to activate those doctors in that list. And now I can go through, and remember, I picked these at random. So let's go through here and see which ones. Okay, just my luck. But what they would do is I would click on one of those and then it would move the plans that are not in network off of the screen, and you would only see those doctors that are in network. So and then the view details here of the Medicare Advantage plans will show you the medical coverages. See if I can scroll a little bit slowly for you. And then you have your Part D details as well. And this is where it is going to show the doctors as well. And then your pharmacies. So you don't have to go digging for where are those. You can just scroll right down and you can see all of that information. Tier 6 is a legitimate tier. This is a few and far between, but this is a tier that some plans will have, and that will indicate that that drug is usually going to be $0 to $15. That's all they're going to pay. So this one, it's $0 that they pay for that. So
Clayton, real quickly, when it comes to drug costs, I have gotten this question. Is it calculating the full year? Is it calculating the remainder of the year? How is the system set up to come back with those calculations and those examples?
So it's a great question. So that is actually pulling from what you put in for the effective date. So if we look at this printout right here, my effective date is September. So all of my prices here, it's going to start from September, and then my totals are going to be based on that September timeframe. Once the plans drop in January, or not in January, I hope they don't drop in January. That'll be a rough AEP.
Right.
When they drop in October, that's when we're going to have January forward, because we just don't know what the prices are right now. So we're not going to have all those. So then at January, you're going to see the entire year for that cost. So good question. Comparing plans for Medicare Advantage is the same. So you just compare the plans together and you'll be able to see all of that information, monthly cost breakdown for those, costs, pharmacies, and then the doctor coverage. Okay. And we do show every single doctor in the country. I don't know if I said that before. If they're registered, they're in there. We also show nurse practitioners, we show PAs, we show all of them, podiatrists, they're in there. If they're registered, they're there. So now let's go back and let's say that we are going to do, let's say Humana. Okay. I'm going to hit save on Humana. What that does is it brings back that quote to this screen here, and you can see that you quoted that PDP, and then you also quoted a Medigap plan. So Clay, how do you quote a Medigap plan? Well, great question, Jason. So let's go in and let's quote a Medigap plan. What we will do is we will take all of the Medigap plans in your state based on the state that they're in with its zip code. Okay, so these are initial filters right here. So you can have it immediately calculate the household discounts. You can have it immediately show just select plans. If you wanted to do a high deductible G, you could do that. Any of the plan types there. I'm going to hit run a Medigap quote. And this is, again, going to pull in all of the plans within that state. And you can see that my scroll is pretty long here. So what I would do is I would narrow these down by the rate type or the rating class. So if I wanted issue age, this would narrow it down. Now I have two plans that are the rate type of issue age. The question that I get a lot is, Clay, can I narrow that down like you can with the MAPD and the PDP plans where I just want to see certain carriers? No. For the Medigap, we don't have that. We will be doing a makeover after AEP this year. There's just not enough time right now to get that in with everything else that we're doing. So next year, this is going to look similar to what we have for the MAPD and the PDP plans. So now, once you select that, you just hit save this plan. You can view the details of that. You can print or email this to your client as well. And let's go back to our consumer page here. So now that I've gone through and I have entered in all of their information for the profile, I did just show you how to do a plan quote. But let's talk about Blue Button for a moment, because I know that's something big that might be new to a lot of you, of how does that actually work? So what I'm going to do, there's two ways. You can do it yourself. You can do the Blue Button import on behalf of your client if they're not techie. And, you know, there's that generation, you know, those that are 85 and 90. My mom's almost 80 and she ain't touching computers. So you would be a broker that would say, okay, I'll do this for you, but you need to have a limited power of attorney signed. And that limited power of attorney will be coming actually in this release, Jason, as well. So that will allow you to send a power of attorney to your client to say, hey, I'm going to be doing this for you. Can you sign this? And it would just give you the access to do the Blue Button on their behalf. Then it would save that automatically in the documents folder once you have that Blue Button authorization. So going back to this screen, you can email all of your clients at one time this request to do a medication update. You can also say, you know what, I don't want to send it to all, I just want to send it to my PDP customers. This will send an email that looks similar to this that says, hey, dear John, this is how this is going to work. This is what happens. This is how long it's going to take. The workflow that you'll want to do before you just send this out to your clients. I hear this from all of the customers I talk to. Because of your relationship with your client, you're going to want to send a prelude email that says, hey, I've joined into this new system. You're going to be getting some emails. We're excited to be using this. It's going to make things a lot better. Whatever you want to say in that prelude email to kind of introduce what they're about to be getting, because a lot of people might look at this and be like, oh, this just wants my information. So all of the customers that I talk to, all of my agents and brokers, that's what they're doing. So that's something that you'll want to probably think about. But this email, I'm going to go ahead and go through this process right now so you can see that. So I'm going to send Jennifer Lawrence an email, which is a medication update email. And now at this point, I am going to take off my broker hat and I'm going to put on my beneficiary hat, and I'm going to show you what they will actually see as they go through the system here with their email. So I'm going to log out because I can't be logged in at the same time. I'm going to come into my email. Again, remember, I'm the beneficiary now. And I'm going to go into my email here. It's time to conduct your annual Medicare review. Okay. So now I pull this up. Dear Jennifer Lawrence, it's time to conduct. This looks a little bit different from that one that I showed you because I did pull up this button. Excuse me. So it's the first thing they see. We explain how it's going to work. How long is it going to take? Why are you asking me to do it? And then we have this little disclaimer in here as well to kind of help show you're getting this because of this. Okay. Now the start my plan review, this is going to go out and take a look at the system and say, hey, are you already in the system? If not, let's create your account for you to be able to do a Blue Button import. So this account is within Trusty Select Pro. I'm going to validate my date of birth and then a unique password. It can be any password. We don't do any validation on any sites or anything with this. I'm going to agree to the terms of service. And now this is creating that account, and I'm literally in Trusty Select Pro right now. I, as a beneficiary, if I wanted to enter the data myself, if I didn't want to do a blue button import, you can do that. And they can, you recognize the screen. So they literally are in the system. They can input anything they want. Okay. For this, what I'm going to do is cancel here because I want to actually do the blue button import so you can see how this works. So I'm going to do import my data from mymedicare.gov. The first thing we have to do to link the mymedicare.gov account to Trusty is we need to log into mymedicare.gov. So I have a fake username that I use. This is given to me by CMS. So there's a lot of dummy data in here that I don't like, but this at least lets you see the screens. If you do not have, if your client signs that SO or limited power of attorney, and they say, just take care of this for me completely, Clay, and they don't even have a account for mymedicare.gov, that limited power of attorney lets you create that account on their behalf. So you'll want to have that created before you get into doing the blue button. But once you create that, you're going to put that information here. You're going to click login. And now this is going to give you two options here. This is saying, hey, Trusty is asking for some of your information, share all of your data or share just your healthcare data. You want to do share all of your data because that's going to confirm the first name, last name, date of birth, and their zip code. Okay, so if you've spelled their name wrong in any way, that will take care of that for you. For me right now, I'm going to do this one because I don't want John Doe to come over and mess up all the stuff that I have set up. That's just for me with this dummy account. So I'm going to hit allow. And what this is doing now is it's gathering all that information from mymedicare.gov. It's pulling in my current plan. It's pulling in my Part A and Part B. Now it's passing and I'm pulling in my drugs. Now it's passing a token. And that token is what you will want because that will allow you to do this blue button import from their profile. You will not have to take these steps again in the future. That token is something that CMS has agreed to with us to say, hey, let's make this easier for your customers and your agents to be able to do a blue button import. And so we're going to give you what we call the keys to the car, the token. And that token connects the database together with Trusty Select Pro. It doesn't matter what their password is up here. We're connected behind the scenes now. And I'll show you that here in a minute. So this is going to bring this information up if they want to. Silly Clay, you forgot my phone number there. I can put that in. This brings in the current plan that they have. And it will also bring in their medications. Now, remember, I had some medications typed in here, but they're gone. The reason why is because we will only bring in, we will copy over and only bring the blue button information over for you. So I don't have any medications on that dummy account, so it brought over nothing. So, but what you can do is you can also type in your own medications. So this right here is Google Forms. That's why that's showing right there. But this will show you exactly like it does in the product in the platform as a broker. Okay. So you can enter in if it didn't pull anything over because you just went to the doctor last week and you haven't filled your prescription yet, it's going to show that. Your pharmacies and doctors will come over in the profile, but right now this is only showing what you have already entered in their profile. Now, when I hit done adding medications, this is going to finalize what you have put in. And this is now going to say, hey, great, you're all set. Clayton Bowen with Trusty IAD training. He's going to be in touch with you, or you can call him at this number here. And just ask for Yvonne because Yvonne handles all of that stuff, right? I'm just kidding. Now, this link right here, they can actually save this link and they can sign into this later if they want to. If they're tech savvy, they can do that. And then you get notified as well when they actually get into the system. So for now, I'm going to close out of this and I'm going to go back to putting my broker hat on. And this happens when I train just because I have two systems up and I'm trying to do the broker and the beneficiary at the same time. So you won't have that issue. That now when I go into this system here, see, it also did a quick quote for me. So that last screen that was finalizing, it was running a very quick quote. But you can see right up here in the top right, I get notified. Jennifer Lawrence did a blue button, updated her profile because of the phone number, and then we also added a medication, right? So you get notified of that. Now at this point, that's the blue button. That's how that works. So let's fast forward here a little bit and let's talk about the batch processing. I have gone through and I've worked so hard, and I have put in all my medications. I put in all of my current plans. I'm ready to go. I'm sitting here a week before AEP, just chomping at the bit saying, please AEP, get here. You know how excited we are. And then we're the same way. It's like buying a boat. You're excited on the first day and you're excited for it to be over. Now I'm going to do a batch process. So what this is, again, I flip over to the batch processing view and notice I don't care about the quoted plans. And remember, over here, I haven't done any quoting yet. All I've been working on is getting their data entered. So this is only going to look at the current plans that I have in the system. So what I do is I will select all of my clients at one time, and I'm going to do a batch comparison. So now what this is doing is it is now processing every one of these clients, and it's looking at what is their current plan, what are the drugs they have, what zip code are they in, and then it's going to give you a quote, and it's going to say, okay, here's the plan that's the lowest estimated out of pocket with the highest drug coverage. Here's your current plan. You need to stay in your plan. You need to change your plan, or you just need a new plan altogether. So the way I need to refresh this, and you can see it's already gone through and it's processed this many. Okay. Let's focus in on Tom Brady for a second. Not because he's a great football player and I have issues with Tom, but we won't get into that right here. But anyway, so Tom has a stay in plan flag. So he's on Clear Spring Health right now. So based on his medications, this is saying, you know what, you're in the right plan right now. So we've determined that you should remain in your current plan for 2021. The recommended plan is this. Here is the 2020, here's the 2021. Now this will change once we get the plans dropping, of course. That's why the batch process really doesn't do you any good right now, because you want to wait until we get the new plans dropping to do this. But what this does is it compares and it says, hey, great, this is done. So now your workflow, when you come in, no longer do you have to sit and go through, I'm just going to say a number of 60% of your clients that are on PDP plans that are typically stay in plan. You don't have to go through one at a time and do a plan comparison, and only to figure out after that 20 minutes of time, only to figure out that they just need to stay in their current plan. So we take care of all that for you. And then all you do at that point is you click on send email, click on the stay in plan flag, send that email, and you are now done with every single one of your stay in plan flags. That sends them this actual form right here. And now you can focus in. See, there you go. The email sent successfully. And this, you can now focus in on your other clients. So let's take a look at change in plan. Tina Turner, she is showing Zing right now, but we need to actually take a look at what is it saying to change. So this is saying, and this is a Medicare Advantage plan. So I did this specifically to show you that we can do a batch process for Advantage or PDP. I will say, this is just kind of Clay talking now. You know as well as I do that Advantage plans require a little bit of work, right? You got to go in and make sure that really this is the plan that has the right medical coverage. It's not a one size fits all. So typically the batch processing is going to be for PDPs, but we do allow you to do the Advantage plans as well. Okay, so that's kind of why I showed that one here. So this one is recommending this plan here. So this again is where you will want to look at Zing and see, is Zing one of those? Is it a common plan in Michigan?
Not real common, but it does exist. Yeah. Does
it? Okay. I'm just wondering why it's having me change that plan. Is that plan one that's going away, or is that one going to stay?
It was, I think, came in around last year, and it is improving. It's still here. So yeah. Mm-hmm.
Okay. So let's take a look at a PDP plan. So Mutual of Omaha, Elizabeth Montgomery, who's probably the greatest witch of all times on TV. I still watch her reruns. She's awesome. This one is showing the SilverScript SmartRx is the recommended plan, but she is on Mutual of Omaha. Here's your SilverScript SmartRx. So the estimated out of pocket is 92, and you're actually going to go down to 2760. Okay. So this is helping you with that as well. The change in plan. So you would want to get all of your stay in plan taken care of, send out that bulk email, and then now you can focus in on your change in plan flags. Larry Fitzgerald, who is probably coming back to the NFL this year, he says new plan. So what we're going to do here is it's going to say lowest cost, and here's your next lowest cost, because he doesn't have a plan right now. So this is going to give him two options. Okay. So this will then send, you can send all of those new no plans or a new plan flag. It's kind of one and the same, right? No plan, you can send that, it's done, it's gone. And then now that takes care of stay in plan, and it takes care of new plan flag, those that are a no plan, as soon as that gets done sending that email. So that's going to really help alleviate your administrative burden. Is there anything you want to add on that one, Jason, for the batch processing, or any questions?
No, and maybe what we can do is just field a couple questions, because I know this is a huge piece to this platform that we've been talking about since day one, and even the live events we did this year. This is probably the number one component, because we know all of you are out there working hard. There's a limited time you have to do all of this work. Some of you are managing hundreds, if not thousands, of PDP clients. To now be able to do those all at one time with the click of a button is a huge time saver. So, maybe we can just see if there are any questions for a quick moment. I do have one come through, Clayton. So does the email come through to my email address or some address that might go to a spam folder?
Really good question. Really good question. So let me show you. Let me go into my email here. So this will come in. So remember, I emailed all these out and I set them all up in email addresses that come to me so I can show you this. So it comes in from info@trusty.care right now. And so these will potentially, if it depends on how their email exchange is set up. So it may go into their inbox, it may go into updates or spam. This is something big, and I do, since you touched on this, I want to talk about this for a second. The info@trusty.care is something that we are changing, and that's going to be coming from you, from you as the agent, not info. That's something that I don't have the date. I'll need to follow back with you, Jason, on when that is going to be done, but we've had a lot of discussions, and if you go out on our customer portal where we have the enhancements, you'll see that that one's out there as enhancement request, and it's leading the votes for people that want that changed. Yep. So it's a big thing. And I've talked to our business analyst, and he's in agreement. He said, we got to get this done like now. So right. I'll send you an update on that, Jason, so you can feed that down to your team as well. But right now it is info@trusty.care. If they reply to this, it'll send a ticket over to us, and then we reach out to you directly and say, hey, Mary just contacted me, Jason. Do you want to take this, or do you want me to help them? There's sometimes agents will say, hey, Clay, can you just help them with that? Sure, we'd be happy to. We're just not going to do that without your approval. And sometimes the agent wants to be on the phone with us to learn as well. So I've done that quite a few times. So it's not that this is going to be accidentally replied to and go off to Neverland. We get it, we see it, and you will be contacted. So,
okay, great. The other question we had, and this is one that comes up frequently. So you showed obviously the blue button integration, but what happens with so many agents either keeping this information on their desktop, or maybe they've used another enrollment platform in the past? Can we get data from one platform into this? What is the process? We get that question often.
Yeah, I appreciate you bringing that up, because I talked about it at the beginning, but I forgot to talk about that. So what you do, instead of doing a single beneficiary, we have a template that you would need to use. This template, let me pull this up for you. Okay, sometimes I love to hate my Mac. Pull it up on my other screen. There we go. So this is the form that you would download, and this is the instructions. But I know the instructions look a little bit daunting, but what we're trying to do is just give you all the information you need to be able to do this. Okay, so you're going to click on bulk consumer. All the information that we need from you to be copied into this form is the first name, last name, and the email or the phone number. Those are the keys that tie that beneficiary into the system. At that point, you can come back later and add other information in bulk, and then it will append that to their profile. You can put in as much information as you want or as little information as you want. You don't want to change the name of this document, and you don't want to adjust or hide any of these. It has to stay exactly as it is. But what you would do is take your Excel format or your CSV file that you export out of your current system, copy column by column, and just paste that information in. We do have all of those instructions that I had on this first tab. What we've done is we've added little pop-outs to tell you how to enter that information. So the phone number, enter it without a hyphen. And there's a quick way that if you do have hyphens in there, you can quickly do look for column E, do a find and select, and then you can replace, type in the dash, and then just replace it with nothing, and then it will strip out all of those hyphens for you in that fast. So all of these fields, you'll just want to pay attention as you do that for, you know, the formatting. So the date of birth, or yeah, the date of birth, month, day, YYYY. But some of this information will not show in the system yet, because we're finalizing a couple of enhancements to the user interface, which is what you look at in Trusty Select Pro. So as an example, the spouse first name, last name, the address, preferred method of contact, all of that information is coming in the system before AEP this year. So if you put it on this form, it goes in the database, and then later it will show up in the system. So once you do fill this form out, now what we'll do is go back into the system. You click on Add Beneficiaries, upload bulk consumer, and then you would select that template. You just double click on that template, and then my file doesn't have any beneficiaries, but if it did, it would take and pull those right in at that point.
Okay, awesome. No, that's a big help. So hopefully, I don't think we have any other questions pertaining to this, but I'm sure all of you who have dealt with your PDP clients on an annual basis see that this is a game changer. You know, this is awesome. So Trusty's been, you know, really ahead of the curve when it comes to innovation, thinking of what's next, how do they expand this platform to make it that much easier, to include other components and parts of the business that you guys have to again, do your job well, but make it simpler, and using this technology in your favor, not making it more confusing or more cumbersome. So we're really excited about not only the other components that we'll get into, but definitely this batch processing is a game changer.
Yep. So I want to take a second and talk about the scope of appointment, because that's a big thing too. So now that we've gone through our quoting, batch processing, now it's time to send your scope of appointment. Okay. So now you can send the scope of appointment from their profile, or you can click on these three dots here and send the scope of appointment. It's one and the same, makes no difference. It just depends on where you want to be doing this. So Tina Turner, we're going to send her a scope of appointment. I'm going to click on the scope. And if you notice right away up at the top, you can actually print this. If they walk into your office, you can get a wet signature and just scan it and upload it directly into their documents folder to keep that, just in case the carrier wants to see that. I'm going to select next Tuesday. I'm going to say the time. Definitely don't want to meet with them at AM. I'm going to select which products, and then the preferred initial method of contact. And this, all this is down here is what it will look like when it goes to them. I'm going to hit send email. And now I'm going to show you, again, I'm going to log out so that I can be the beneficiary, so you can see what they go through as they are doing this. So here is my scope of appointment. I'm in my email. Dear Tina Turner, please click on the link below to securely complete your electronic scope of appointment. I click on begin scope of appointment. And now remember, if you have not been in the system yet, it's going to ask you to put in your information. Okay. Go. I'm going to set the password. And I come into the scope of appointment. Okay. So now, oh, silly Clay, I don't really want to talk about dental and vision. My hearing and vision is fine. Go mow your lawn. That's the Karen, right? So this one, let's see, who was this one? Tina Turner. That's right. That's right. Tina Turner. Tina, what does love got to do with it? That's my question. So now I hit submit, and she can actually print that as if she wanted to. Now notice it brings me right back to the blue button screen. If they wanted to go in and do an import, they can do all that right here. So we kind of go through that same cycle at this point. I won't show you because I already did. It's the same steps. I'm just going to hit log out. And now at this point, move my camera. At this point, I go back into Trusty Select Pro. And I click on Tina Turner. Before I do that though, notice my notification up here. Tina Turner signed her scope of appointment. Okay. So now I can go into Tina Turner, and that scope of appointment automatically saves in here. So now we just eliminated all that administrative stuff that you have to do to print it out, scan it, then upload it. We just alleviated 5 to 10 minutes, right? And that adds up, right? So here's the scope as it looks. It downloads it if you wanted to see it, if you needed to upload that. And there you go. Okay. This is similar to how the flow will work with the power of attorney. It'll be an electronic signature just like that. And then it will save that power of attorney directly into the documents folder as well, to allow you to go in and do the blue button at that point.
Clayton, real quick, the power of attorney, a question did come through. Is that good for the 1 year?
You know, I have not had that question before. For the timeline on that, let me find out on that, Jason.
Okay.
And I'll get back to you so that you can. I'm surprised I haven't had that question before. It's a great question.
Yeah.
Yeah, I'll find out.
Okay. And then the other question, this is stepping back just a few moments, but when it's running the batch comparison, it is strictly doing it against the pharmacies, prescriptions, copays, formularies. For the MAPD portion, it is not doing it for specialists or PCPs, correct?
Not at this time.
Yeah.
What we have in the kitchen is we are cooking up where you will be able to select, is pharmacy the most important thing for you? Is the doctor the most important thing? And then that batch, you run that batch, and then it will look at that pharmacy or that doctor if it's in network, and it will display that plan for you in the batch. But right now it is basing it on the medication and preferred pricing within that zip code for that region that you're in. And it's going to give you the lowest estimated out of pocket, highest drug coverage. So that's on the works right now.
Okay, great. And just for, some of you, as you can see, it's great that it stores these in this document, so you don't have to worry about that paper. But I have spoken to some agents that say, well, this is great. I love these platforms, but I'm still a little bit nervous. Well, there you go. You can take the PDF, you can download it, store it on your, desktop, wherever you want to put that, if you feel more secure having it in a couple places.
Yep, absolutely. And if you want to, you can do your own too, if you wanted to do your own. And you can upload that. Really, the scope of appointments, I know everybody's like, yeah, I wish those would just go away. Because they really don't require those when you do the enrollment anyway. Most of them, it's just have it on file in case you need it, right? So.
And so what now, a good question comes from that comment, Clayton. I know that because these are generic and they're CMS approved, I mean, essentially every carrier has to accept them. I know some carriers do prefer their own. So are you saying we could actually upload a carrier specific scope or a different scope?
Yep, yep. You can upload anything you want from here. So you would need to scan it. They would sign it, and then you can just upload it just like this.
So just like we would be importing the names, medications, all of those details, somebody could, if this becomes their full platform, they could take, the last 5 years of scopes and just upload them into the system to store here.
Exactly. Yep.
Okay.
I wonder if I can select multiple. Let's see what happens. There, let's see. Nope, just one at a time. So that would be an enhancement to be able to take and dump them all. That's a good one, Jason. I haven't had that one before either. That's great.
There we go. It's already getting better.
Yeah, well, that's how we get better. So we'll
Yeah.
bring that up, but that's the product you see is because of feedback that we've gotten.
Yeah.
We live and breathe off of feedback. So
Definitely. Great.
The last piece of the puzzle here is the direct enrollment. So we have the ability within the next little bit to do enrollment directly from the system. So we've gone through and we've done that. Excuse me, the scope of appointment. We can go in here and we can click on enroll, the 3 dots, enroll. And then when we get this, it's not yet fully out yet. I was just talking to Jason before we got on this call. We're just within days. So what that will look like is you go in and you would complete a form that looks like this. So this is the carrier's application form. See how it pulls everything in from the profile within Trusty Select Pro, pre-fills everything. You then would go through that application and you can fill in what missing information that you have to put in anyway. And then at that point, you would then take and send this to your client, and they would get this via text if you want, or email, which they can pull up on their tablet. We know that they typically don't have a laptop or a PC. It would be their iPad. They can pull it up either way, phone or tablet, and then they would go in, review this same document. They just can't make changes to it. They won't be able to move anything or add to it. Once they sign this via DocuSign, it then immediately goes to the carrier. And the carrier then will do a sweep of the system every day. And then you will see that show up in their system within 24 to 48 hours typically. If we have to mail it to them, if it's a carrier that just has no technology, I giggle about that, but some of those, as you know, are behind the times with some of that, and so they want them to be mailed. We will mail that for you. It's all behind the scenes. Literally all you do is just go in, sign it, the client signs it, and then we take care of the rest. Either mail, email, eFax, it doesn't matter. It goes into their system, and then you will be able to log into the broker portal and see that as well. So, but this is what it will be looking like. I will be feeding information to Jason on continually updating on that piece. But this also allows you, at that moment when we get this released, you will be able to do an electronic HRA as well. I know that there's a lot of agents that I talk to, they're like, I just don't have time to go in and complete that because there's so many steps I have to do. I have to go to a site, I have to go, and it just deters them from filling out and making that extra 50 to, what is it, 50 to 80 bucks, $75, something like that. We will have the ability, when you go in and you click on enroll, you will have a button down here that says complete the HRA as well. You click on that, and then it's all electronic, and then there you go. Then you would have that extra $50 to $75 in your bucket as well. So, so that is kind of how the enrollment piece works as well. Jason, is there any questions that you have about that? I know we're up on the time, but
yeah. So we do have a question. Will we get notified by email from Trusty or the carrier of an enrolled application?
So it doesn't talk back to us. That would be where you would need to go out to the broker portal for that carrier, and you'd be able to see the status from there. But it's not a two-way talk. It's not an API direct connection into the carrier. So that would be something you would need to follow up on.
Okay, and another question. So you will email or fax Aetna apps direct if we do the online app.
ask that again?
Yeah, so you will email or fax that in apps direct if we do the online app. I guess we need some clarification on that question.
I'll try to answer that one. Based on what the carrier requires and what they want, that is what we have configured in the DocuSign setup. We've been working really hard on that, and each carrier wants it a different way. They may want it e-fax, they may want it email, and again, like I was mentioning with paper, they may want it paper. So based on what that carrier requires, that's what we're going to give to them. So for you, for all intents and purposes, it doesn't matter how it goes to them, right? Because it's going to get to them one of those methods. You will know which method it is, because back when you go into this screen, as soon as we get that new screen out there, it will say how it went to the carrier at that point if you wanted to see that. So, but the carriers do a daily sweep where they go out and they grab everything that came into the email or the e-fax, and then they process it right away. So immediately once your client signs it, the DocuSign, it immediately gets sent to the carrier.
Yep. So we did get some clarification. The agent said Aetna will require the uploaded app sometimes. So do they need it if we do this app online? My guess would be no.
No, because it's the actual app that
Right.
we populate. So
right. So this is that upload portion that you wouldn't have to do any longer. And just to add to some of the questions that we've been getting around carriers, and just to make sure that we're not over promising, as Clayton mentioned, I mean, they've been working on this for months and months to get it ready for this AEP. One of the parts that we as an FMO partner played was introducing them to some of the carrier partners. You know, they have some of the nationals that they had been working on. We then were introducing the local carriers. And as Clayton and his team knows, every carrier is just a little bit unique. Some of them use third-party vendors to set up their platforms and receive their enrollments. Some do it in-house. Some don't have really the systems themselves. So it is a process. We've been working with some of the local market carriers for the last, 7-8 months now, Clayton.
Yep. Introducing
Julie and your team to connect those systems best they can. And when I talk local carriers, for those of you in Michigan, I'm talking Priority Health, HAP, Blue Cross Blue Shield, PHP, the local vendors that you use. And just understand that there are some that may be available by AEP that will be seamless when you click that enroll button. And there may be some that we have some workarounds that we're creating, whether it be through the DocuSign portion, e-fax portion, or in some cases, if the carrier has restricted those from happening, it may hyperlink you into their enrollment platform and you can go from there. So we're essentially working through that process. If we don't have it done by AEP, the goal would be to start fresh again in December, January, and keep moving this forward so that eventually all carriers, both national and local market carriers, will be accessible with a seamless enrollment process from Trusty all the way through to the carrier. We did have one other question on cost. This is a platform that we have brought in as a service and a tool to our agent partners. So we at Insurance Advisors Direct, we are absorbing the cost of this platform. And if you're a contracted agent that's selling with us, this is again a service and a platform that is free of charge for you to use. All right. Clayton, anything else you can think of before we wrap up?
Not that I can think of. I've touched on everything I've wanted to. I think I just want to make sure that you're taken care of and that you don't have any other questions with anything that I've talked about.
Yeah. And now the other portions of this, we did talk a little bit about the lead portal. This will also be able to be used as like a CRM tool for agents. It will have calendar component. Anything else you'd like to speak to as far as what's available today and what may be on the wish list for tomorrow?
There's a lot on the wish list for tomorrow.
Of course.
There's a lot that we want to do, and we've sat down and we listened to all of our customers, right? Like I was saying, and we just have to prioritize, and we need to figure out what can we get in this AEP and what's going to wait for next year. There is going to be a couple of things, like lead distribution. We're going to have that. We're going to have the ready to sell. We're going to have that calendar that Jason is talking about. That's actually something that is going to flow into the producer dashboard here. And there's going to be a calendar in this little white space right here, and it's going to integrate with Google Calendar. So you'll be able to write back and forth with that. As far as what's coming, I talked a little bit about the Medigap supplements. We're going to be redoing that, the way that functions. That'll be a big one as well. Boy, you put me on the spot with that one, Jason. There's a lot we're doing next year too. I'll have to pull the list together, but it's all based on feedback from our customers. So yeah, if you have any feedback that you want, Jason and the team can show you how to submit that feedback. We're going to be working with them. We do have a customer support portal. Yep. So Jason will talk a little bit more about support and all that as well. So absolutely. And as Clayton mentioned, this AEP, and as you guys get immersed into this program, use it. Yeah, please send that feedback to us. We will pass it to Clayton. They'll go to work to, whether it be maybe fixing a bug that's found, or obviously enhancing the tool and the platform. And that was one of the other reasons why we decided to partner with Trusty to create this easy enroll platform with IAD. Is we saw their vision, we heard what they were doing today, but also what they wanted to turn this into tomorrow. When we looked at some of the other platforms that exist out there and maybe have been around for a few years, they might be ahead in certain components, but ultimately, most of them have said, hey, we're an MA enrollment tool. We're a PDP enrollment tool. That's it. And when we talked to Clayton, one of our concerns, and I think all of you would agree with this, is the technology today has been great, but it's also become a bit confusing and cumbersome for agents, because here you have your CRM tool, you have maybe your email campaign system, you've got your Excel spreadsheets, you've got your carrier logins, you've got your enrollment platforms by carrier. If you want to sell a Medicare Advantage and then add on a hospital indemnity, you have to go to 2 different places. If every step of the transaction requires you to almost log in to a new platform and be familiar with a new technology. And no matter how much you are good at technology and up to speed on it, it still is difficult. So talking with Trusty, our goal is to take this as it is today, which is great, but they're willing to build on this and create all of those components and link those other processes and link those other carriers, so that eventually we hope to have a platform that you have one single username and login, and you can do all of those transactions, make those sales, communicate with your clients, set up your appointments, and really do everything through this one single platform. And they're committed to that. And that's what we liked about the Trusty platform as well. Mm-hmm. All right. I don't think we have any other questions. We just have a lot of good comments and feedback. Looks like everyone's excited, so we appreciate that. There is one question. Is there a sandbox feature to this, Clayton? There is not a sandbox in particular, but what you can do is exactly what I've done here. You can add a beneficiary into your system here. And what I've done, what I do, come on, Jennifer, is I add my email address. So you saw that I was getting all of those emails from them. So I think that's mainly why you want this sandbox, is so you can kind of play with it and see exactly what comes back as they're getting it from the customer side. You would just set up the test clients and then just put an email address like this, like with Google on the back end. I don't know if Jason, if you guys have Google as your mainframe on that, or if it's something else. So we'd have to check and see, but Google has a feature here where you can do plus, and then it ignores anything from the plus sign to the @ sign. But Trusty sees it differently. So I set it up that way. But we don't have a specific sandbox environment for that. I don't know, Jason, if that's something that we can consider setting up for you to just have as, I don't know, like a brokerage setup thing where everybody can just kind of hack away at it and add stuff.
My opinion is, and maybe I'm wrong, correct me, Clayton, but once you get logged in, I mean, it kind of is a sandbox in a way. You can play with it, you can test things. I don't think you can hurt anything. There's only so much you can do. So I think you can go ahead, you can play around with the different parts and pieces, log in a couple sample clients, kind of get familiar with it. So I think in a way it kind of is its own sandbox anyways.
Yeah. And if you wanted, since it is in your live environment, what you can do is just select those that you put in and change the status to archived. Mm-hmm. And then that pulls them right off.
Okay. Oh, that's great. And also with this being a new platform, we are working on a detailed kind of step-by-step instruction. If you are not currently set up on this platform, please notify us. We'll be reaching out to each of you who are in attendance today to help do that. If you need some additional assistance, you can contact our team. But again, we will be putting together kind of a simplified in-house step-by-step instruction. But certainly, if you haven't gotten set up and you'd like to, and you haven't heard from us, please just reach out. We'll make sure we get you going. All right. Anything else, Clayton? I know we went over a bit, but I appreciate you spending your time to be with us. I know this was valuable. I think everyone pretty much hung on till the end. So it goes to show that these are valuable tools that we really need to know about and be using now, but especially for this coming AEP. So again, we want to thank you and your team for all your hard work. We want to thank all of you who joined us today for being on and being a partner to Insurance Advisors Direct. We look to continue to bring these types of systems and value to you so that you continue to grow your sales, and we hope to earn your business. And if you have any questions, please reach out to our team. And well, we look forward to future events. We will be doing some additional training events in the future. This was kind of an introduction that Clayton wanted to do. We did dive in maybe a little bit deeper than we had expected on the onset, but we are going to do some deeper dives as we get closer to AEP and really start to show you the true components and how to use them. So keep an eye out for those invitations as well. All right. Well, thanks, Clayton. Thanks, Tiana. You guys have a great weekend. Thank you to all of you. Have a great weekend, and we'll be in touch.
Sounds good. See you guys.
Bye now.
Bye-bye.